Okay. All right. Well, I'm here. I'm going to be interviewing Dr. Jeff Ibbotson. Dr. Ibbotson is a senior health advisor to the United Nations Institute for Training and Research, UNITAR, Program in Health and Development. He has more than 25 years of experience in surgical, humanitarian, and disaster relief work, most recently in Nepal for 2 years. Jeff was trained in Toronto and Calgary, had a surgical practice in Grand Prairie, and was the chair of the Alberta Provincial Trauma Committee from 2014 to 16. Since 2019, he's been in Geneva and most recently as a founding member of the Global Surgery Foundation. And I'm interviewing Jeff as part of the UBC Branch for International Surgery course in global surgical care. So Jeff, it's great to see you again.
Yeah, Brian, it's good to see you. Thanks for the invitation to come and be part of this course. It's I've known about the course for many years, and in fact was involved back, I believe, in 2013. So it's great to be part of it again in this way. And greetings from Geneva, Switzerland, and United Nations, and United Nations Institute for Training and Research, and the Global Surgery Foundation, which I all work with all of those organizations. It's wonderful to be a part of this session.
Well, it's especially great to have you as a fellow Canadian, and I think really I think Canada is hitting beyond its batting average for in terms of contributing to global surgical care and global surgery organizations. But today we're focused in this module of the course on discussing advocacy. But first, I think I'm going to ask you to give a little introduction to this new initiative, the Global Surgery Foundation. So what is it? What's the focus? Where did it come from? Where do you see it going? That's a big question, and we've only got a short time, but give us a little insight into this, this new initiative.
Well, the history of the Global Surgery Foundation, which I'll refer to as GSF because it's just a little shorter. The GSF concept started back 2016, shortly after the Lancet Commission on Global Surgery, where a number of us, Walt Johnson in particular, felt that there was a need for a common platform to help advocate and promote the work of global surgery and the agenda of global surgery. And just following the great examples of organizations like the Global Fund and Gavi, having it based in Geneva, Switzerland, firmly embedded within the United Nations agency system was a good strategic start for this. So essentially what we've created is an organization that's UN based that can serve as a vehicle, as a common ground, a common platform for any stakeholders working in the global surgery space. And we're building up partners throughout the world, mainly focusing on the low-income, low-resource settings, and also across the spectrum of global surgery, most importantly, including anesthesia, of course. And so we're at the startup incubation phase, but really getting some exciting traction moving forward and partnering with many different organizations and already a number of Canadian organizations. So we're quite happy for that Canadian connection.
Well, I was quite impressed looking at the leadership, the initiative, obviously having yourself involved. You've got Dr. Makasa, who I think was the one from Tanzania who introduced the World Health resolution to the World Health Assembly a few years ago, advocating for more resources for surgical care. And you've got Dr. Mira, who, one of the leaders of the Lancet Commission. So that's a pretty exciting group to work with, I'm sure. So advocacy is one important aspect in the field of global surgery, sort of one of the non-clinical things that we do to varying degrees in our practice. So this is sort of a general question, I guess. What experiences do you think you've had that have made you a better advocate for global surgical care?
Well, looking at what the definition of advocacy is. You want to think of whether it's for your individual patient, advocating for the best care for your individual patient, wherever you are in your setting, whether I'm in Grand Prairie or you're in Hamilton, you're going to fight for the best for your patient. And that's, it's just, you want that best care available. Now, the reality is, in many settings around the world, that those options aren't there. And just going back to when my career started in global surgery, it was as a young consultant surgeon going overseas and seeing the suffering of people that I know could be easily treated and go home in a week or two perfectly well, but instead dying in those settings. Mm-hmm. Obviously, that just stirs up a passion within you to fight for equity. And you mentioned Emmanuel Macassa. I don't know anyone who's more passionate about equity than Emmanuel. And I've learned a lot from him, and just showing that passion of fighting for what is needed in that setting. So there's many different layers of what that advocacy can be. I think, though, if you want to, in terms of your listeners who are possibly early in their career as a surgeon, or possibly near the end of their career as a surgeon in Canada, but thinking of entering the realm of global surgery, one of the things that I've found is really important is to be an advocate, you need to experience it. You need to actually see firsthand and experience that inequity that occurs in the world. So I find that you can become a very strong advocate for this cause when you go and you experience it for yourself. So when you have a young child die in your watch because of something simple, because of a perforated appendix, and he got to you too late, or you didn't have the tools to treat him properly, you'll never forget that. And just having that, living that inequity with the people who are living it on a day-to-day basis builds within you a passion of advocacy when you come home and you carry on your work, whatever that may be. Now, that can be happening right here in Canada, because there is inequity in Canada with the First Nations, and even within inner city. There's many reasons why there's inequity right within Canada. There's a lot of talk about universal health coverage, and being around the world and seeing many different health systems, I still think that Canada has one of the best systems in the world, particularly if you're trying to achieve universal health coverage. But even within one of the best systems, there's still inequity. And there are still people in Canada that don't have universal health coverage for multiple reasons. And getting out there and experiencing that is a real stimulating force. So I think just that experience and creates that stimulating force to be a vocal advocate for whatever level you feel you should aim at.
Yeah, I think many health professionals went into the business because of that passion, and certainly getting involved in global surgical care is in some ways a way of keeping it ignited or reigniting it. But I take your point. Experience is so vital to generating and being a true advocate. I mean, we hear. There's a lot of discussion these days around allyship and advocacy, and being a good partner or ally without making mistakes, if you like. Good intentions, are obviously, not enough to be a effective advocate. Do you think can you comment on any common pitfalls or mistakes that a visiting surgeon might make, for example, in trying to advocate for improved surgical care when they go to visit a low resource setting?
Yeah, it's very common, and I've made these mistakes many times. So I sort of chuckle as I hear your question. It's very common or it's a common mistake to go into a setting and say, "Why are you doing it this way?" And then become critical of the very people struggling on the front line. And so the best recommendation, and I'm sure people have heard this time and time again, is go in as an observer and learner at the beginning. I think that the best scenario versus the typical parachute in and parachute out scenario, that can be very problematic, but is to build relationships with the local people who are there all the time. And then through that, learn what their experiences are, learn what they feel their needs are, and then support them as they're trying to move their agenda forward. So in essence, being an advocate is supporting and advocating for the people on the front line. And, you know, we can use Emmanuel as a great example. There's Emmanuel down in, he's actually in Zambia most of the time, but he's connected with Witwatersrand in South Africa. But there he is, and he's constantly calling out for support. So to partner with people like Emmanuel, or there's a multitude of others around Africa and Asia, to work with them as a partner and long-term partner commitment. These people on the front line, they've seen people come in and out and disappear. I think that long-term relationship is a vital key to success. Global surgery, you can think of it as a vehicle. And in some countries, that vehicle isn't working terribly well. It's not moving down the road very well. The tires may be flat, or, you know, it's just not working well. And too often, us surgeons from Canada or wherever come and they say, "Here, let me get in the driver's seat and I'll show you how to do it." You get back and start pushing the vehicle. That's not the way to do it. We should be the guys at the back helping push. That's a true servant advocate. And encourage the frontline workers to be in the driver's seat driving. Now, it doesn't mean we can't yell up the front saying, "Hey, turn left just a little bit there." But we have to be firmly at the back as the people pushing the car out of the ditch. And I use this example a lot, but we don't like that servant advocate role. We want to be the hero in the car waving as we go by.
That's
and so it's really important to try to get that mentality, that principle ingrown into our program.
That's a fantastic metaphor, and I've experienced exactly that in a physical sense. In fact, the last time I visited Guyana, I was with a group of surgeons, and the bus got stuck in the sand. And some of us were out there, some of the younger ones were out there pushing from the back. But I think that's a great image of our role in helping to push surgical care ahead. So thank you for that. One of the things that comes up when you're trying to advocate, and can happen in any setting as a surgeon, but I'm wondering if you can think back to any examples of your time in Nepal, where advocating for the individual patient seems perhaps to be conflicting in interest with advocating for the system. We're sort of talking about, I guess, about the ethical concept of the greatest good for the greatest number. And sometimes that means that individual patients can, don't receive what they need. And that, I think that's personally, I guess that's one of the sources of conflict I think I find, and probably many surgeons find wherever they work. Do you have any thoughts or experiences about that from, you talk about equity and I'm sure that the examples that you gave of things that you've seen in Nepal that were frustrating when you were trying to advocate for individual patients and also advocate to improve the system.
Yeah, the most striking examples are actually with pediatric burn patients. And there's always the case of resources. And oftentimes these these very serious burns need multiple debridement procedures as they get the area, the grafting area, ready for the graft. And each time you take them back to the operating room for another procedure, it eats up resources. Mm-hmm. And you can see the staff getting more and more worried because there's only a limited amount of resources. The other thing I've experienced with that is just simple dressing changes on the ward with the pediatric burn patients. And of course, most of the time I'm in the operating room, so I don't see exactly what happens. And I hear afterwards that sometimes the pain medications weren't given. And you hear stories of the screaming and the pain. So then you go down to advocate for the patient, saying, you do not do this without the proper pain medication, which I have ordered. But there's a few layers of that onion that you may not understand. And again, going back to resources, cultural differences, so forth, it's a very challenging approach. And so in advocating for the patient, you need to be aware of all those layers that need to be addressed, and yet still finally make a decision of what's right for the patient. But then I could be challenged on what's right for me in my mind isn't what's right for the stakeholders, your colleagues who are there 100% of the time.
Yeah.
And if we go in for a short period of time and eat up all their resources so that there is no medications left when we leave, because we did it right during our 3-month period, but then for the next 3 months they have nothing. Yeah. That's what we don't necessarily understand, and they won't necessarily tell you that either. So these are the challenges that are faced, and it's not an easy line to walk.
That's another very good example, I think, as you said, of burns. And it's sort of an example where, you know, what we may consider the best practices or best evidence-based practice here in Canada, given our resources, may not be the best practice in Guyana or Nepal, where resources are different. And you may have to learn a different way that may have just as good outcomes, but may take longer, or you may need to learn some different ways of managing patients. And I think the other point you raised there about understanding the impact we have when we bring a team in, for example, to take over a hospital and, you know, operate and take over 3 or 4 operating rooms for a week. The local hosts may not tell us about all those hundreds of patients that didn't have their surgery last week because we were there with our big surgical team. So I think those are both good examples. So finally, do you have any suggestions? I mean, for a young person, we've sort of talked about a few things here, but in general terms, given the sort of the direction of your own career, which I'm not sure you could have anticipated or planned when you first started, but do you have any suggestions for a young person who's developing a career in global surgery, whether they're in anesthesia, obstetrics, surgery, or other health professionals? Any general insights, you know, how to get to where you are now, if that is something they aspire to?
Well, one of the things that I think about, the most valuable experience that I've had through my career that helps me the most where I'm at now, it is again that frontline experience. I can sit down now with top government officials, presidents of big NGOs or UN agencies, you know, the Assistant Secretary General of the United Nations, and I can share with them the realities of the people behind the statistics. We can do all the statistics and publish papers and so forth, but I think it's still important to put a face and a personal experience to those numbers, and to have that frontline experience to say, you know, I have experienced this firsthand, and I can tell you, after watching these people suffer and die when they didn't need to, I am impassioned to make a difference. And because you've had that frontline experience, you get listened to as a physician in those settings of advocacy on the high level policy, but I think it carries through all the different levels. And we had actually a Zoom call just yesterday with some very high level individuals from some of the top foundations in the world, and shared with them the situation in Africa as a result of COVID, including the fact that in Kenya alone, there's an estimated 22,000 new and unexpected teenage pregnancies as a result of the kids not going to school in ages down to as low as 11 and 10 years old. Jeez. And the reality is many of those girls are too small to deliver safely and will need a C-section to survive their pregnancy. And this is what we're hearing from surgeons in Kenya. And I'm sure that's the case across the continent. And so when advocating these frontline shocking examples of the statistics, it's also important to be able to say, I've met these people, I've walked alongside these people, and that adds a lot of credibility to your message when you're sitting down with people advocating for the situation in Africa or in Asia.
Mm-hmm. I think that's a good place to end. And thanks so much, Jeff, for your insights today, for your contributions to this course. I'm just going to actually finish up with another promo for the UBC course in case there's anybody watching this who is interested in finding out more about it. Again, all the best to you, Jeff. I look forward to seeing you in person, I hope, the next time at the Bethune Conference or at some point when we are able to get back together again. But I really appreciate your time today, and I wish you all the best with the Global Surgery Foundation.
Well, thank you very much, Brian, and great work what you guys are doing in building up the community of global surgeons, and keep up the good work. Thank you very much.
Thanks, Jeff.